What if braces are not always the only answer to crooked teeth? What if the tongue had a greater role in our overall health than we thought? What if the tongue can impact the entire shape of our face, our airway, and our dental alignment? What are we missing? What role does the tongue play? Orofacial myofunctional disorders, also known as tongue thrust, have a key role in figuring out the whole picture. In evaluating an orofacial myofunctional disorder, you first want to make sure that you go to a fully certified or qualified orofacial myologist who has specific training in the area of treatment. Did you know 90% of speech-language pathology graduates have no training in identifying orofacial myofunctional disorders? The certification is an additional 12 to 18 months, including a 4-day extensive course, a thorough written examination, and 8 hours of observed therapy and evaluation by a fully certified orofacial myologist to ensure you have competence. At this time, there are only 3 fully certified orofacial myologists in the entire state of Idaho. One of those clinicians is myself. In 2019, all 6 speech-language pathologists at Boise Speech and Hearing Clinic will be working toward their full certification. Boise Speech and Hearing Clinic has been active in the field of orofacial myology since the early 1970s. The program at Boise Speech and Hearing Clinic was developed at our clinic alone, and it's called COMP, the Chatterton Orofacial Myofunctional Therapy Program. What is orofacial myology? It is the study and treatment of oral and facial muscles and how they relate to, first, speech. A high number of people with an orofacial myofunctional disorder have a frontal lisp on their S and Z sounds, and also have errors on their R sounds. Second, dentition. Orofacial myofunctional disorders cause open bites, overjets, deep bites, and small narrow palates. Third, chewing. Chewing is loud and disorganized. Food may be all over the mouth, and the individual may be told they are sloppy eaters. Fourth, bolus collection. How do we organize the food in our mouth? Is the food, after swallowing, still all over the tongue, pocketed in the cheeks, or does it take multiple swallows to get the food down the throat? Fifth, swallowing. Swallowing is affected by a tongue thrust swallowing pattern in which the tongue pushes against or out of the front teeth. This can increase risk of aspiration or dysphagia in older clients. Sixth, overall mental health. It can decrease self-confidence and self-awareness. Seventh, physical health. Many people with orofacial myofunctional disorders also have sleep apnea, TMJ, enlarged tonsils and adenoids, fatigue, and tooth decay. What does therapy look like? Each individual comes in for a full comprehensive evaluation that we look at many different areas of their health. We look at airway. Do we have a free nasal airway for closed mouth resting posture? Birth history, allergies, function and posture of oral structures, including cheeks, jaw, tongue, and throat. Is there a history of a tongue or a lip tie? We then make a plan for that individual. Therapy is 1 time per week for 30 minutes. The COMP program is a series of 10 lessons focusing on changing muscle memory for the following: jaw stabilization, lingual mandibular differentiation. Can the jaw and the tongue work separately from each other, or are they doing all movements together? Tongue and lip resting posture during the day and the night. Retraining the swallow to make sure we're using efficient pharyngeal movement. Each individual will progress at their own rate, depending on their severity of coordination and their needs. The patient will be given a series of exercises to perform at home 3 times a day to reshape and to change the muscle memory. What happens if we don't treat an orofacial myofunctional disorder? If a child is an open mouth breather at a young age and it is not identified as being a problem, then this open mouth resting posture encourages tongue down, lip open resting posture during the day and night. When the mouth is open with tongue down and forward throughout the day and night, the individual is more susceptible to hypertrophic tonsils and adenoids and enlarged nasal turbinates. When these tonsils and adenoids are enlarged, health risks also increase, such as they're more susceptible to viruses or bacterial infections such as strep throat, sleep apnea due to restricted nasal airflow, full body postural changes, and weak overall facial musculature. With open mouth resting posture, facial features develop differently. The face appears long with poor definition of cheekbones. The mandible or jaw is retracted and small, which affects the airway size, making it small and at higher risk for sleep apnea. When teeth emerge, they are misaligned. If the tongue is forward and down at rest, the teeth will find space to grow, and that is when we develop open bites or overjets. The palate is high and narrow due to the open mouth breathing. The nose shape can change as well, as the eyes looking tired versus alert. Over 50% of orthodontic patients exhibit some form of orofacial myofunctional disorder. If you are an orthodontist or dentist and are concerned one or multiple of your patients have an orofacial myofunctional disorder, we want to work with you. We work closely with a variety of professionals to provide the best comprehensive care and treatment that we can. We communicate openly and often with other healthcare professionals, including ENTs, sleep apnea specialists, primary care physicians, craniosacral therapists, and others. What are some common signs or symptoms to help identify an orofacial myofunctional disorder? First, a high narrow palate. Second, an open bite, overjet, crossbite, or deep bite. Little to no diastimas at a young age or overcrowding. Open mouth resting posture with tongue against or protruding against the teeth. Incorrect forward thrusting swallowing pattern. A history of tongue or lip tie associated with difficulties with breastfeeding. 7, severe allergies or history of recurring upper respiratory infections. 8, a family history of orofacial myofunctional disorders. So what sets us apart? We see results. We have seen hundreds of clients ranging in age and severity. To see some of our results, check out our website and see our before and after pictures. If you know someone who has an orofacial myofunctional disorder, we are here to help. What should you do next? We provide a complimentary 15-minute screener that we can sit down with your patient, family member, or possibly yourself and talk about concerns and our recommendations. Give us a call at the number listed below or click on the link to set up your free complimentary 15-minute screener today.